A little over a year ago, on the 20th of September 2017, the strongest hurricane in decades, Hurricane Maria. Now, while its effects and impact on the island's infrastructure, economy, physical health have been discussed in great detail, one aspect that might not be as prioritized is Maria's effect on the mental health of the population. Now, it is important to note that by nature, human beings are biopsychosocial organisms, meaning, in order to survive happy and healthy, they require biological and psychological health, as well as a functioning social environment. Thus, it is important to evaluate the effect of disasters, such as hurricanes, based on these three levels: biological, psychological, and sociological. Studies regarding disasters and its effect on mental health state that traditionally, it is estimated that 70 to 75% of the victims will present transitory symptoms of anxiety and depression. 5 to 10% will present serious symptoms with psychotic problems, while 10 to 15% will remain relatively unaffected. This proving that primary care in mental health is incredibly important post-disaster, seeing as around 80% of the affected population suffers from poor mental health after suffering such tragedies. As can be seen in the previous chart, the most frequent psychiatric diagnosis can be seen in form of anxious depressive symptoms. These signs of anxiety and depression occupying a percentage of 70 to 75 in victims affected by natural disasters. Among these, the most common symptoms include post-traumatic stress disorder, major depression, and generalized anxiety. Alongside this humanitarian crisis caused by Hurricane Maria, Puerto Rico's psychologists also worried about a possible mental health crisis. This being due to the fact that many pharmacies were closed, meaning antidepressants, antipsychotics, and other medications were unavailable. Treatments were disrupted, and doctors couldn't be reached since cell phones and internet service were down. Some remote mountains were essentially quarantined by blocked roads, and reports of increasing suicide rates concerned the island psychologists. A report published by NBC News on February 2018 shows that 5 months after the hurricane, the rates in suicides have increased in Puerto Rico, reaching new heights after experiencing steady drops in the past years. In the year 2016, as can be noted in the chart, there was a number of 196 suicides, which was and still is the lowest rate in 2 decades. But in the year 2017, there was an increase of about 29% in the number of suicides, there being 253 suicides that year. Although there has been no official investigation to correlate the two, experts have said that natural disasters do have an impact on mental health. NBC News states that while at least 103 people committed suicide after the hurricane's passing, along with increased spikes in suicide rates in the months that followed the hurricane, there has also been an increase in suicidal ideation, this being having thoughts of suicide. Around 5,000 people called Línea Paz, a government helpline, from September to January. But data on these calls remains low between the months of September and October because of the lack of phone service post-Hurricane Maria. But then, once phone service was reestablished, the number of calls shot up. While the previous year only saw about 3,000 calls to the helpline. It is important to note that Maria's repercussions did not end a few months afterwards. The people's suffering, loss of homes and businesses was not completely fixed. Even a year after the hurricane's passing, many people still are without homes, jobs, food, access to health care. While metro areas such as San Juan have mostly recovered, outlying towns and mountain hamlets are still plagued by rolling blackouts, polluted water, high unemployment due to shuttered businesses, and outward migration. There have been several initiatives made to provide mental health services to victims, but these efforts for the most part focus only on the most immediate post-impact period. While disasters may have long-term consequences, and active participation of other health professionals is necessary for the management of the resulting psychosocial problems. Mental recovery is not something that takes a few weeks to fix. There might not even be a way to completely fix it. Initiatives that only prioritize recovery for a short span of time after the disaster do not take into consideration how much a tragedy can affect people's lives long term. Mental health care for the victims, especially over middle or long term, also requires inclusion of mental health in general health. This meaning, mental health treatment is not something that should be thought of once a disaster occurs. It should be something that's integrated into a person's daily lives, hurricane or no hurricane. This doesn't mean everyone is quote unquote crazy. Treatment is good for peace of mind, healthy body. Similarly, efforts in disaster recovery should not focus solely on physical and economic safety. Psychological recovery is also vital for the victims. They have seen and lived through a great deal of occurrences, losing their homes, family members, jobs. The sheer amount of hopelessness one feels after such an event is not something one just moves on from easily. Finally, mental health is important for the general well-being of a community. A population cannot function effectively if its residents are suffering psychologically. Mental health might be a bit taboo among the general population, but needing help, even if it just after a disaster, is nothing to be ashamed of. The brain is an organ, and occasionally it needs a little help as well to ensure one is happy and healthy.